there is an injustice. There really is. The system isn't rigged in a way that supports everyone in the same way. That really was a trigger to start looking into Lumi and into the research. And to be honest, Lumi, when I first started looking into things, was just me on a mission to understand the problem more. The actual thing that rings a bell with me in terms of what was it, I found out that children were lonely, and I found that really difficult to get my head around.
Welcome to the MindTech podcast, where we dive deep into the unsolved problems in mental health with the founders, investors, and experts building technology to solve them. How can we use technology as a bridge and not a barrier to human connection? Dr. Mark Cox is the founder of Lumi, a startup that answers this question by using technology to help families reconnect through a blend of digital and real-world experiences. Mark is an NHS Doctor with 5 years of clinical experience, currently working part-time in A&E while he builds Lumi. Listen to learn the importance of family support in managing child mental health, how to use technology to get people off technology, and how MindTech could be integrated in schools, not just hospitals. Let's get into it. Why did you choose to focus on mental health? What's the story behind that?
Great question. Yeah, it's twofold really. There's multiple things that have gone on in my life that kind of precipitated this kind of crazy decision I've made to potentially jump ship and move into a different space, albeit I'm balancing the two at the moment. I have worked for about 5 years as a doctor, and from a professional standpoint, have always been searching for that specialty that really called out for me. I've had a long time now locuming, so taking some time part-time. I'm getting on for nearly 4 years of locum work, and despite trying multiple different things, nothing really has reached out to me and grabbed me. And it was maybe early 2022 when I started to potentially suffer a little bit with my own mental health. I was waking up every morning with a pit in my stomach, getting on my bike, going into work, and this was all whilst working kind of Monday to Friday as a locum doctor. I wasn't quite the same me as I am now. I was a little bit short with my partner. There was lots of different kind of little signs, and it was only kind of retrospectively looking back that I realized that I was probably depressed. I was functioning, doing well at work. I was performing, all of those kind of classic measures of like, do you function in society? Is it affecting your life? Objectively, you would probably look at me and think that I was absolutely fine, but inside me, I was a bit of a wreck. And it was only sort of retrospectively through therapy. I was in a privileged position to access some therapy. I was recommended someone by a friend, and they were brilliant. And through that process, I realized that, I was struggling. I was struggling mentally. I'd never seen myself or imagined myself struggling mentally. And it really opened my eyes. I had previous to this started talking online through the Straight Talking Doctor about, I started talking about COVID through the pandemic. I started talking about mental health, but I hadn't necessarily been burnt myself, or I hadn't really experienced what it's like to struggle with your mental health. And until you do, it's very difficult to, I think, fully understand it. So that really intrigued me. I'm one of these people who kind of sees the problems in our lives or the challenges we face as massive opportunities. It's taken me a long time, I think, to get there. But now it's clear to me that they are your greatest teachers. And it taught me an awful lot. It taught me, I always say I'm grateful for that experience. I really am. Like, I'm profoundly grateful that I suffered, and it was a 6-month period where I wasn't myself, because now, one, I know when the signs are coming, when I'm experiencing things that aren't in line with how I want to feel. Two, I have the utmost desire to make sure that never happens again. Like, I'm hell bent on, if I feel like that and it's been more than a day, like, I will be doing things as much as I can to get myself feeling right again. And then three, I guess it intrigued me and inspired the passion for what I'm doing now with Lumi. So I mean, that's kind of like from a kind of personal level. It was very much linked to my professional level, but professional experience. And then from a kind of why did I see Lumi as an opportunity? I think working in a system such as the NHS, you see so much good, but there is also always things that we want to change and improve. And I have seen throughout my 5 years people that come into hospital who I feel like have not necessarily had the support. And that's not just on an NHS level, that's the wider system. There is an injustice. There really is. The system isn't rigged in a way that supports everyone in the same way. And I felt that very strongly. I've always been someone with a kind of, bee in my bonnet about things that I don't think are fair. And that really was a trigger to start looking into Lumi and into the research. And to be honest, Lumi, when I first started looking into things, was just me on a mission to understand the problem more. I think that's a massive bit of advice I would give people is, if you feel the inkling to start something, just start, just go and explore the space. The actual thing that rings a bell with me in terms of what was it, I found out that children were lonely. And I found that really difficult to get my head around. So I started speaking to my co-founder, Ewan. He's been working in social care as an assistant psychologist. And we'd always said, maybe on a few late nights together, that it'd be great to start something one day. So I sent him off one way doing interviews, and I went the other way doing interviews with as many people that would speak to us. And it's been a long process, but we're getting there. And we feel like there's an opportunity to move forward with Lumi. Yeah.
Thank you so much for being open about the struggles that you faced personally and leading with that vulnerability. I think the courage that you showed to develop the self-awareness about what was going on in your mind and the agency to actually do something about it and see those obstacles as opportunities is very admirable, and it's a fantastic way to become a founder when you feel like you were in need of the very thing that you're trying to create. Now, you mentioned there that particularly loneliness amongst young people was a specific problem that you'd identified. And I can't wait to dive deep into that. But before we do, and it may be linked to this question as well, I wanted to ask you, what do you feel you needed that you didn't get in your journey?
I have to caveat, that my vulnerability with, I'm very lucky. I've come from a decent background. I had a fairly stable upbringing. I wouldn't class myself as someone who went through, huge levels of trauma, for example. Um, I did well at school, all of these things. And so for me, I very much believe that it was easier. I was in a much more supported position than a lot of people are when it comes to mental health. And so I always think that's important to kind of mention, because not everyone's coming off on a level playing field. And again, that's one of the reasons that we want to do with what we're doing with Lumi. But saying that, what was it that I didn't have? I mean, you go back to my time at school, I don't remember ever talking about mental health. It's very different at schools these days, I know. But there was no understanding of it. There was, I grew up into my teenage years, my adult years, thinking, "Oh, I've done well at school. I was a good boy, and I did well, and I'm going to be a doctor, and I'm going to be fine." There wasn't really much emphasis placed on what really is important when it comes to your well-being. And I mean, I'm 29 now, so that wasn't a long time ago. And I think, it's amazing to see how far we've come on. I think we're really on that kind of exponential curve when it comes to understanding, breaking the stigma. All of these things is great. But I hadn't had that. It was a big step for me to go to therapy. I didn't have lots of friends that had done that. That was a really important step in creating that self-awareness, putting myself on that journey. And then I think, to link it to what we're doing at Lumi, I struggled to speak to my family for a long time. And, if they listen back to this, I don't know how much they would fully understand in what position I was in, because I've probably not been as open. And, family really is the number one kind of thing for most people. And they're the closest relationship to the first relationships we ever form. They hold a real power in terms of our attachment. And I think that was something that was potentially missing, the ability for me to open up in a way that was helpful was very difficult.
So noticing these patterns amongst yourself, the people around you, and in the patients that you treated in hospital, of people being admitted due to poor mental health that had been going on for too long and lacking support around them from their family, and overall this impacting the system around them. This has all led to you feeling the urge to create Lumi, which is fantastic. So what is Lumi in your own words?
Big question. Lumi has a few different arms, but is still in its kind of early period. So we have lots of different ideas, but Lumi really is created for the problem you so well articulated there. We want to create a support system for families that helps them build resilience, respond better to challenges, or respond more easily to challenges, and also reconnect. So we see the problem that you've outlined with the system. Looking wider than that, we have this kind of world that has changed so much so quickly. We haven't caught up with it. What our parents have to do, and what parents have to do, is they have to learn to reparent themselves. They have to learn how to parent. But they're parenting a situation now which they really can't fully understand, because they haven't been a teenager with social media in this situation, where life is dominated by technology, where connection through the phone is far more common than connection with other people around you. There's literally millions of families sitting across the world, even in the UK, who are connected by their screens, but they're disconnected from the other people in the room. And Lumi really is trying to capture that essence of that problem and flip it on its head. So use technology to reconnect people. So there's lots of different things that we would like to do. We see that there's a massive problem across the spectrum of mental health, whether or not it's people in complete crisis, whether or not it's SEN, whether or not it's kind of early intervention and prevention. I think with Lumi, our first aim is across a spectrum, is to create a family-focused support system. So an app that will, in its first essence, and what we've created so far, will support parents, because we see parents as the real kind of linchpin in this process. But over time, we'll start to support other family members. We think at the moment, with mental health, it's very, and this was from my experience as well, mental health is very focused on the individual, yet we know that family systems are incredibly important to the well-being of our young people. So we want to create a solution that really understands that and really books the trend with mental health, in the sense of it supports each person on that journey, whether or not you're really experiencing mental health problems or not, because we need to take a preventative approach. For so long, the nature of our system is that we will, support when problems arise. We know that that's too late with mental health problems. We know that 50% of mental health starts before 14, 75% before 18. We know that once people experience depression, it's much more likely they'll experience depression again. Same with most of the other mental health conditions. So it's trying to develop a way of tapping into people before they're necessarily problem aware, or before they're experiencing the problem anyway. That's incredibly important, and that's what's with Lumi. We're not trying to say we're going to do absolutely everything. We're trying to look at the gaps in the system and connect the dots. And so yeah, we hope that we can kind of fit around this process of supporting a family, helping them reconnect, supporting them with specialist needs if they do have specialist needs. And then if things do go wrong and they go through the journey, we're there to step in and be that continuous support throughout the journey, because that's where we see the kind of support lacking at the moment.
So, how exactly do you help families connect with each other in person and help them create that safe space to engage their children in meaningful discussions about their mental health, or engage the father, the mother? How do you facilitate that connection in and amongst a family unit?
Great question. So, I mean, where we're up to at the moment is we've built a simple platform that supports parents, and we're pilot programming that with schools, local authorities, and other organisations. And we launched this month. The progression of the app and the building of the app will come over the next few months, and the key really is, how do you engage young people when they have so many other pieces of technology? How do you engage them with your app? Now, at the moment, our plan is to introduce things like gamification, to introduce kind of like a rewarding experience to make things as engaging as possible for young people. But one of the things that we're doing in the background is setting up a service called Lumi Local. And Lumi Local is in-person community events. And we want to, in some ways, test what we want to do on the app through actually getting in front of our audience and testing that process with families. So we'll put on family focused events. We're doing a launch event hopefully in April. And we're testing some of the things that we are creating behind the scenes in the Lumi method, which is all around different concepts linked to the concept of flow. And what we want to do is get people off screens. We want to connect them in ways that have maybe fallen away over the last 15, 20 years in the digital age. So in terms of specifics of how the app will do it, things are to be created and to be decided. So I don't want to go too far into specifics. There's lots of different ways that we want to test, that we will do over the next few months. But I guess my advice for people around that is, we are doing that in person. I would say that doing things in person and getting a real, if you have the ability to put something on, to test something in person, it's always going to give you more information, I think, than over online. And so that for us is key in multiple things, hopefully building a brand, building an emotional connection with us as a brand, and really getting to understand our customer base. Because like with everything, this is an assumption that we're making, that this is doable and this is what families want. But if we get in front of families and it doesn't work, then of course we need to be agile in the way that we approach this problem.
It sounds like you're really taking a grassroots approach where, bottom up, you want to help people in their communities connect with each other and lean on each other in a way that's a great vision for humanity, really. And instead of trying to build a system that just reacts to issues of the mind arising, building something that's more proactive and developing that form of connection, that form of support that people can more easily access when they're feeling low, that kind of approach is definitely missing. I feel like this is also very much linked to mental health being just as much as an educational priority as it is a health priority, really, because we all need to be educated on how to take care of our minds, our mental health, and a lot of that starts in schools, of course.
Yeah.
Now, with Lumi's school program, which I've been reading a little bit about online, clearly this is something that you guys value very much as well. So what are your thoughts on educating children on their mental health in schools?
Great question. If you go back in our journey with Lumi, if you look on Company's House, you'll see we were originally called Buzzed, and we went into schools and did workshops. And that was one of the first things we really did as a business, quite a long time ago now. And it was a fantastic process. Really enjoyed it, and we learned a lot. It's really where we started focusing. Actually, we kind of pivoted in some ways towards parents and seeing the bigger picture, seeing this family picture. And what I kind of came away from that day was, from speaking to these particular students, is that from this school, they had tremendous amount of mental health education, and they kind of said to us, we've done loads of this. We've been talked to about education, about anxiety, about building resilience. Like, people have talked to us about it. On the other end of the spectrum, there are schools where I think, I've heard there's minimal education and there's minimal focus. But the takeaway for me around that was that you have to do more than just go and educate and talk. And kind of mental health is more than saying something, more than just giving information. Mental health is, I think, intrinsically a societal issue, and we are coming at it from a perspective of trying to psychologically change people. But so often our problems are linked to our kind of situation from a societal perspective. And there are multiple different angles there. Of course, there's lots of crossover, but what we're doing at the moment is very much focused on one side. We have to change things on a more systemic level, on a societal level. And part of that is creating opportunities for young people to actually engage with something that they want to engage in, that they feel like there's hope. I think young people are, by nature of the world, very distracted. I think it makes it difficult to latch onto hobbies and interests that really feed our kind of well-being. I think we've already spoken about the connection side of things, and so we have to, when we go around educating people, try and create more than just a talk, more than just we've been doing that for a while now, and I don't see a sharp improvement in our general mental health. So I think we have to take a kind of wholesale, full 180 shift in some ways. All of that is important. I'm not neglecting that, but we have to do more. We have to create more opportunity, more things that young people really actually, they really actually buy into and they dig. And then you'll start seeing wholesale change and wide scale change in our mental health. I think it's a similar concept. I wanted to kind of tail back to your previous question. And that I think, in terms of the solution we're creating, yes, it's proactive, but also I think there's a thing where, again, I'm not saying therapy is not the answer. For me, therapy is incredibly important. Therapy is huge and is such an incredible intervention, but it's not always what we want, particularly as a family. Saying that we're going to family therapy can feel very heavy. It can feel like if you're saying, if I, take the example of me and my girlfriend, if I say I'm going to couples therapy to my friends, I would feel like I would find that harder personally, showing my own stigma. I'd find that harder personally than saying I'm going to therapy myself. It's kind of like saying, oh, the couple, in some ways, people can read it. You'd be worried they'd read it as like things aren't working and whatever. Whereas when I thought of therapy for myself, it was more like I'm doing this to kind of prevent. At the time, I probably looked back and thought I actually really needed it. But what I'm saying is that we need to come up with solutions that are different and do different things to complement what we already have. So I think, the number of therapists has increased from 127,000 to over 200,000, I think, in the UK in the last kind of 4 or 5 years. Now, that will be beneficial over time as more people access therapy, but we still have a massive access problem in the NHS. We know that the threshold for treatment is incredibly high. Unfortunately, the service is set up to support crisis and can't really do much else. So we need to think about those sort of things. So I'm taking a roundabout route to say that school and where our education program comes in and our link with schools is really to do a few things, is to kind of, I think the conversation has been normalized, but to build on that and to try and create behavior change, to try and create something that young people like buying in with, to target people who are younger than we think that we need to target. So target them before they hit that teenage years, before they hit that transition period. Make this normal for you to sit with your thoughts and do some mindfulness, or make this normal for you to connect with your family. Obviously, it becomes a lot more difficult as a teenager, as we have changes in attachment, and our adolescence changes who we want to be around. We want to be around our peers and maybe not our parents, but it's still important that we have that way of communicating with our parents that I definitely didn't necessarily have taught to me, or I didn't have modeled for me. Again, that kind of feeds into the same theme: is we need to model this behavior. We need to make this something that people, we always hear that kids don't do what you say, they do what you do. So we need to model it as the adults around them. We need to teach parents how to model this behavior. We need to teach teachers how to model this behavior. When you start doing that, we start making, vulnerability normal. We start making connection normal. We start putting the phone down and listening, with active listening. All of these other things that seem quite simple but are so often missed. We create that cascading effect down. So yeah, I would say it's around creating genuine behavior change, and hopefully not just coming in and talking to people about their mental health.
Yeah, because if you imagine people going into a school to deliver a talk, for example, I know you mentioned you did some workshops yourself. Now, if they gave the most captivating talk of all time about mental health and it managed to captivate the minds of children of all ages in assembly, let's say 5 to 11 in a primary school, you've got their attention, you've got all the teachers listening, you've normalized mental health, you express how important it is to be able to share how you're feeling, and the children walk out feeling, I don't need to hesitate to share if I'm feeling down. Now, as captivating as a talk like that can be, as you mentioned, just lecturing it or giving that information, it's it's not enough if that's where it ends as well. So how do you see Lumi taking on that creative challenge of being able to engage young people and families in meaningful ways that extend beyond just information, that really make that behavior change that you mentioned? What are the real practical specifics, examples of how that behavior change can be brought about beyond just giving information?
Again, a great question. I think there's a couple of different things that we are proposing that and we are kind of visualizing being something that can help with this. There seems to be a lack of connection in some places, or a lot of the places we've spoken to, of school life and home life. So there's a bit of a breakdown. I mean, for an example of this is that we're hearing a lot of young people either refusing to go to school at the moment, or when they go to school, a lot of young people are having quite normal behaviors. So potentially masking some issues, or at school they're coping, and they're thriving, or mainly coping, I would say. They then go home and are completely different to the behaviors shown in school, and parents are really struggling. That's just one small example, but we're hearing, more often than not, that there seems to be some form of discourse or disconnect between school and home life. And I think one of the ways from our kind of tech side of things is to create this link between what's happening at school and what's happening at home. And by having an account that you can have each family member on, you can have parents on, you can have students on, there is an ability for us to kind of take information from what we're learning about that family, what we're learning works well and what doesn't work well, and helping create solutions that will then transfer into school. So, I mean, trying to think of some specific examples of this is that if we have that solution and with different family members on, you can have specific examples of activities that work well within the family to create conversation. And we can then prompt that through learning from the school. So there's kind of one side, which is the tech side of things, that I think can try and create some behavior change and some actual meaningful change when it comes to family life. The other side of things, as I kind of briefly mentioned before, would be around Lumi Local. And again, we want to create these experiences that families can come to, that can be linked in with school communities. That's how we're rolling it out from the pilot program perspective. So partnering with local authorities, partnering with schools, and hosting events which are either put on because they've been funded by somewhere else. So, either public funding or grant funding, or a very accessible ticket price. And you get to come, parents get to spend some time with other parents who are potentially going through similar things or have similar interests. They get a little bit of time away from the kids because we'll take them off into one of our specific activity zones. We have a few ideas about creating quite a quite a memorable experience with these activities. And we do this at an age where young people are still willing to buy into kind of this process. And we take them through a class, which, as I mentioned very briefly again before, grounded in the concept of flow. So we look at things like, things to regulate your emotions, activities based around mindfulness, positive psychology. And then also a big part, I've been trained as a systemic coach, and I'm working with a couple of coaches at the moment to help build on some of the coaching philosophy to try and teach young people the principles of coaching early on, and also teach the parents the principles of coaching. So some of the activities would be done together with parent and child, and some of the activities we would take the children off and the parents would do separately, giving the parents a space to kind of healthy vent, be coached on any issues. And I think ultimately you have to understand the limitations of technology. There is so much that it can do, but at the same time, when it comes to mental health, there has to be, like you said, the word grassroots. There has to be real life things going on. And I think I see Lumi Local as a real potential to create that. I think there's a huge gap. I think in the next 5 to 10 years, we'll see a big push towards in real life things and events because of the way AI is going, VR is going, AR, all of these things. I think you'll see a breakaway and a kind of counterculture pushing towards IRL in real life events. And we want to make sure that we create something that has genuine impact, and it feels like an experience rather than it feels like you're going to work on your mental health. As much as I love therapy, it felt like I was going to work on myself. I think there's a middle ground. I think whilst therapy is important, I think so many of us need those experiences that are enriching, that are supportive, that create genuine connections with other people. We'll have a policy of, 0 phones when you're in the space and that sort of thing. Like, I don't know how strict that would be. I'm just kind of thinking off the top of my head that, there's going to be ways in which we create this kind of authentic environment that is based around connecting with other people. So there's a couple of ways. I would love to give you kind of more insight and specifics around how the app would do it, but I'm kind of postulating because, like I mentioned before, we're on that kind of discovery journey. We're going to schools, we've built version X, we want to get to version Y, but I know that in 2 months' time there's going to be a few ups and downs and rounds before we fully sign off on which features we're building, for example. Saying that, I think AI will play a big part of that, and having kind of an adaptive AI process where the AI can learn from one family member and then apply that to the conversations it has with other family members is a really interesting concept. Can you have an intelligent kind of tech, like it's like having a therapy trained uncle who kind of sits there within your kind of family conversations and, can be there as a support for you if you need, and kind of just gets it, kind of understands your family. That for me is something that's really profoundly exciting, and would be really cool if we can deliver on that. There's tech challenges within that. There's privacy challenges within that. We have to assess, again, do families want that? But having someone, having it like someone who and understands you can provide support, round the clock. That again is really important. And I'm not saying again that gets rid of the need for therapy. It's just that added extra support for a family.
Wonderful. I'm really getting the sense that a core value underpinning everything you and your team do at Lumi is connection, and not just forming connections between humans, but connecting what happens at school with what happens at home, and connecting with the physical environment, as well as parents, as well as teachers, as well as with other people. So what a fantastic value to have underpinning everything that you do, a real need in this world. And when it comes to facilitating relationships and having that be the conduit towards improving mental health, I think that is a very worthy cause. So, Mark, it's been absolutely fantastic to learn all about the way that you and your team are helping families find their flow, of course, and the exciting stage that you're in with exploring all the ways that you can do that. So, for everyone listening, how can people support and follow your work?
Thanks so much. Yeah, it's been a great conversation. I hope it comes across. I'm incredibly passionate about this, and I think there is so much more we can do, and it's exciting times. You know, there's new technology around. There's a real drive and hunger for people to make a change, and we really hope we can deliver on that. In order to support, I'm always available on LinkedIn myself, or I'm also at the Straight Talking Doctor on Instagram. But for Lumi, it's www.welcometolumi.com. We'll be launching our socials soon at Welcome to Lumi. And yeah, please do get involved. If you're a school or a local authority, or you have any kind of interest in this space and you liked listening, then please get in contact with me. We're always looking to expand and support as many people as possible. So yeah, thanks so much for having me, Manu.
Of course, it's been a real pleasure and very refreshing to learn about such a holistic, family orientated, community first approach that is a form of technology which gets people off of their own technology. So, Mark, it's been a real joy, and thank you very much for coming on today.
Thanks, Manu.
Every startup that has featured on MindTech is solving a mental health problem with a technology-enabled solution. To get a full picture of all the problems these startups are working on and all the solutions they're offering, sign up to the email list in the description to access the MindTech Matrix. This is the first visual representation of how mental health problems are being matched by innovative solutions. You'll also be updated whenever there's a new episode and get early access to test some of the products that are discussed in the podcast. Everything you need is in the description.